At the same time, the procedure enhances the appearance of your foot, so that's a bonus.
Nichts scheint die New Yorkerin so zu elektrisieren. Schuhe, Schuhe, immer wieder Schuhe. Die teuren Läden sind fast Kulttempel und ohne mit der Wimper zu zucken, werden Hunderte, manchmal sogar Tausende Dollar ausgegeben, um die Füße neu einzukleiden. Doch nicht jeder Fuß ist schlank genug für die teuren Designerkreationen. Aber was nicht passt, wird passend gemacht. Naomis Füße waren zu breit, sie hat sie sich schlank operieren lassen. Der Arzt hat mir wirklich jeden Zeh gebrochen. Er hat sie dann alle gerade gebogen, die Knochen abgesägt, um die Füße schlanker zu machen. Das war im Prinzip alles. Der Mann, der diese Wunder vollbringt, hat eine ganz und gar unmondäne Praxis. Unter dem Schreibtisch liegt der Mops, wenn Dr. Zong sich die manchmal obskuren Wünsche der Patientinnen anhört. Bis zu 15.000 Dollar kostet eine Fußschönheits-OP bei ihm pro Fuß. Die Frauen bringen wirklich ihre Schuhe zu mir in die Praxis und bitten mich, können Sie meine Füße passend machen? Wir erklären ihnen dann die Prozedur. Natürlich wäre es viel einfacher, wenn Sie sich passende Schuhe kaufen würden, aber wir leben halt in New York. Heute kommt Lisa mit ihrem Mann zu Dr. Zong. Auch sie ist nicht glücklich mit ihren Füßen. Sie sind zu breit, sagt sie, und tun weh, wenn sie ihre Lieblingsschuhe anziehen will. Ja, ich hoffe, ich werde nach der Operation diese Schuhe wieder tragen können. Und vielleicht auch Schuhe, die noch sexier sind. Lisa kommt auf den OP-Tisch und Dr. Zong markiert die Stellen, die er wegschneiden will. Das hört sich schlimm an und es sieht auch schlimm aus, deswegen bleibt die Kamera dezent im Hintergrund. Er schneidet den Fuß auf, holt den Knochen heraus und sägt ein Stück ab. Lisa merkt von all dem nichts. Eine örtliche Anästhesie und ein Schlafmittel betäuben den Schmerz während der fast zweistündigen Operation. Das scheint ja ganz gut geklappt zu haben. Ja, es ist wirklich sehr gut gelaufen. Sie wird sehr glücklich sein und auf jeden Fall wieder in ihre Schuhe passen. Erst aber müssen die Wunden heilen, das kann ein sehr schmerzhafter Prozess sein, sagt Dr. Zong. Lisa ist nach der Operation fix und fertig, aber irgendwie auch glücklich. In ein paar Monaten will sie ihren linken Fuß operieren lassen. Das kostet dann nochmal rund 15.000 Dollar. Wenn alles glatt geht, kann sie schon im Frühjahr ohne Schmerzen in ihre neuen Schuhe schlüpfen und mit den anderen New Yorkerinnen über die Fifth Avenue stöckeln.
High heels have been fashionable for centuries, even though they can cause serious foot problems as well as knee, pelvic, or back pain. It's not just the height of the shoes that can lead to damage. Many women routinely wear shoes several sizes too narrow, just to display their jewelry of the feet.
And surgery for the feet right now is so common. It's like getting a flu shot. The styles now is so glamorous. It's like jewelry for the feet. And most women that do come in here, they want to look their best. So they will go out to have things done to their feet just to be able to wear that particular shoe.
I was scared to wear sandals or wear sneakers in the summertime, even hiding it from my boyfriend. I didn't want to touch my feet. I was very ashamed of my feet.
Along with the hammer toe deformity, she had very bad corns on the toes that were discolored and just did not look cosmetically appealing, at least in her eyes. And we removed all of those skin lesions, and now her toes are perfectly straight, and the skin lesions are gone.
My feet were, should I say, manly still, and I just wanted to make it look prettier and more feminine.
The interesting issue about Lauren is that she did undergo some procedures to change her gender. She did all the visible things that one would think of, you know, with the face, with other body parts. Ultimately realized that her feet really weren't the best looking, and she wanted to do something about that.
We got the bone cut here.
Just from doing toe surgeries like we did with Lauren, or doing a foot narrowing procedure to help them fit into a pump. It's a new niche market.
So how long has it been from your surgery? About a month, right? On both feet?
1 month here, 3 weeks here.
Okay, so let's see what they look like. The toes are pretty straight. You still have a little bit of residual swelling. They look very nice.
I wish I had the before picture so I could look at them and laugh. Towards my transitions, I started breast augmentation and doing facial surgeries, and I guess my feet was my last goal. Finally found the right doctor for that one. I thought I was gonna have a lot of scars and the way it looked at first with all the stitchings and everything, but it looks great.
So when you going to the beach?
I already went to the beach.
No, really?
Yeah.
Showing off the toes already.
Definitely.
I started in private practice about 3 years ago. We thought we could create a niche here in Manhattan, and now we have patients coming from all over the world for cosmetic foot surgery. It'll even go so far as a woman will bring in a pair of shoes and say, I really would like to fit into this. Is there anything you can do to help my foot? We have had some outrageous requests, such as cutting off fifth toes and things like that to fit more comfortably into a shoe. Obviously, that's, beyond the realm of normal medicine. The girl that we're about to do surgery on, she has a congenital foot problem along with other issues. It's called brachymetatarsia, and it's a short metatarsal that causes the condition. And because the third toe is so short, the rest of her foot has deformed around that condition. We're going to get rid of this bunion, okay, which is going to make your foot more narrow. Okay, it'll look something closer to like that. We're going to straighten out your big toe, okay? We're going to straighten out your second toe, straighten out your fourth toe to give this toe room to come out. And we're going to make this toe a little skinnier and do a little toe tuck procedure on it. Okay, so it's going to look similar to something like that with this toe elongated over time.
Very good. Okay. If I knew that it was fixable, I would have definitely gotten it done a long time ago. I feel very insecure about my feet, and I'm hoping that that'll change once the procedure is done. I've never, ever wore open-toe shoes, so this is definitely going to be a change in lifestyle.
This really needs a lapidus. We're shaving down any rough edges. We were able to achieve getting rid of the bunion, which you can see here, and significantly straighten out this big toe, which is going to allow us to bring this toe over and this toe over to make room for when we lengthen the little toe. We're going to be placing what they call an external fixator on that toe, which will look like an erector set, which will remain on her toe and will take several months in order to lengthen that bone. There are going to be several pins within that bone. The bone will then be broken, and then the patient themselves, every single day, will be lengthening that bone on her own by turning a knob on the erector set. And generally, it's about 0.5 millimeter to 1 millimeter of length that you can gain per day. She needs about 2 centimeters, so we're looking at about 20 days of lengthening in her case. All right, this is essentially the finished product. So she's going to turn this once a day. It's going to bring this out, and when we get to the point where we like how it looks, we stop turning it, take the apparatus off. It's a very controversial subject here in the States. It may be because it's a relatively new idea, but I just don't think that demand will go away for these type of procedures just based on the amount of volume of requests that I see currently. I would say half of the podiatrists in the United States lean towards being against cosmetic foot surgery, whereas the other half are either undecided about it or pro. The Orthopedic Society in the United States is probably the same way.
Our job as an organization is to educate the public. We're not telling you, do this, don't do that. But what we are saying to the women is, you need to know what the complications are before you get into this, and then make a decision. Don't just jump into something thinking it's a panacea, that you can go into high-heeled shoes, walk all day in them, and never have another problem. It's not Cinderella land.
What is practical? When it comes to high heels, I don't think anything is really practical. Everyone wants to look good, everyone wants to feel good, everyone wants to be a star. So people do go to the extreme to make it work for them.
There's so much peer pressure today to look beautiful, to be sexy, to have control, to have power, and it's subtle brainwashing. Gee, if I look like that, then I too would be in that position. And so I think that's what drives the high heels. It makes women think that they're sexy, it makes them think that they can become powerful, and it gives them a sense of elegance, no matter what it takes, at any risk.
A lot of the shows on TV is about fashion, it's about glamour, and the new generation, everybody wants to look that part. Everybody wants to look fabulous. Everybody wants to be tan, beautiful hair, beautiful skin, beautiful feet. Fabulous.
Look how happy I am.
These don't make any girl happy.
I wish I had a boy to buy them for me.
Oh, I'm sure you.
Oh, these are high.
Getting used
Super high.
You gotta get
Can I go
used
with
to
them?
it.
Should I walk with them over here? Look at them in the mirror.
Put those pants so you can see.
I don't want to move too much because I feel like I'm going to fall.
Practice, practice. I look at it this, look what people are going through to wear these shoes. Everybody wants to have that piece of jewelry on their feet.
I love them. They're beautiful. Go dancing, show off my feet and my new shoes.
The problem here in New York, and I imagine everywhere else in every metropolitan city, is that, you know, fashion dictates what people wear. In general, fashionable shoes are not made for walking. We often call them limo shoes. They're just good enough to be seen walking from the limo to your party. Female patients who have had their feet deformed because they've been wearing these shoes and now want to correct those changes, or we'll have female patients who can't wear these shoes and want to have their feet shaped so that they can wear these shoes, and probably down the road their feet will become deformed and we'll have to fix them. It's actually a vicious cycle.
Of course, I'm always thinking, and when I get older, I'm gonna suffer from some type of arthritis, pains, and osteoporosis on my foot. But I think I'm a risk taker, and I'm willing to take the risk to look good while I'm young. Spinderella. I wouldn't even call myself Cinderella.
You're a Cinderella girl. It's a fabulous shoe. Doesn't this shoe make you feel very sensual?